Let me see. I would like to got it. Poof. Now I can see you. Yeah.
So first of all, thank you very much for you're willing to participate our small conference. It's a big pleasure for us to see you. And
thank you for the invitation. That's an honor.
And so I'll be glad to talk to you on some issues of educational process in Gestalt therapy. And you are an experienced trainer, and you've been teaching students in Gestalt therapy for many years. So it will be nice if you can share your experience with us. And I'd like to get started our interview with the question about how were you changing your view on supervision process. We know that it's the important part of learning process for Gestalt therapists. So throughout the years, how were your view changed?
I am very much convinced that this is a very essential part of the training. So we have it in the 3rd and the 4th year, we have supervision, a lot of supervision. And we have it in a way that there are two main trainers always in our groups. And those two trainers, they have each at least two workshops in a year, probably two. And then we give one to some other trainer so that they see different variations or different ways of doing therapy. So when you ask how did it change, I think during the years I changed my way of doing supervision in educational groups in a way that I tried to put in more live supervision, let's say, or to play the client in front of the group, or to do some exercises with some creative media, even with the supervisees, so that the whole supervision became more vivid, let's say. And I always try to make a balance between how the therapist feels in the contact with the client and what is really going on with the client. Because especially in the education, when the people start working, they ask for ideas, they ask for the structure, they ask for these basics in starting therapy, which we then do together. But also, I think it is difficult for the group, if you do group supervision, it is difficult for a group just to listen. One case and another case and another case. So I'm trying to make it more alive so that the whole group can stay with the attention and get interested in the cases which are presented.
Okay. Do you believe that supervision is necessary only for those who are in their learning process of Gestalt therapy, or is it an important part for the professional development of Gestalt therapist in his or her professional life?
I'm absolutely convinced that the supervision is necessary for everybody, not just the people in education, but for all people who are working with the clients. So what we organized supervision. I'm in the supervision for 30 years now, probably, because we organized last 20 years, I organized a supervision for the trainers and for our main, for the people who want it, the main therapist or the main supervisors. It is not a big group. Now we are, I think, 8, last, let's say, 7 years. But before this, it was another group with the people who are somehow connected to the education and want to have a supervision for themselves. It is very good. It is also nice to see the colleagues in these circumstances. So we don't supervise the people in education. We supervise clients generally. But it is, and we have a supervisor from England who is coming now online the last 2 years, but before he was coming a few times a year for the supervision days. We had 2 days supervision 5 times a year, and then we had 4 times a year, and now since COVID time we have it online each month 2 hours for our trainers, for our therapists, which are supposed to be the highest in the position. So if we need it, I think everybody needs it.
It's supervision. Okay, thank you. And coming back to the education process of Gestalt therapy, would you please share a little bit what are the basic ideas, core ideas, which lie in the basis of the education process in your institute?
Mm-hmm. So we have a structure that the people, when they come to the education, they first go to few workshops to have a look what Gestalt is. So they have a freedom to see how they feel in these experiential workshops, how do is this the right method for them or not? So they have this possibility to experiment a little bit before they enter. And then when they enter the education, we have a structure that on the first year, they have mostly self-experience and then some theory, and then they have also some theoretic work to do. But mostly is it self-experience, going into the therapy and getting acquainted and getting more in contact with what Gestalt is. And then in second year, the focus is on working in triads, so client, therapist, and observer, which is like, and then a lot of specific workshops on specific themes, also theory, also, we have this social responsibility and the human rights, and in the second year starts diagnostic one and so on. So, but this is like preparation. So they work in the workshops and in the peer groups. They work with each other, being in the roles of therapist, of observer. So that at the end of the second year, they are fit and prepared to go in the working with the clients, which is then in the third and the fourth year, the main topic. And then in the third and the fourth year, they have a clinical seminars, they have group dynamic, Gestalt, diagnostic 2, and so on. So there are other workshops which help them working with the clients. And they have a supervision in the big group with us, so with the leaders of the education. And they have a small group supervision, 140 hours, 130 hours, something like this, which they have with the supervisors outside of the education. They have 135 small group and 15 individual supervision, which is not with the leaders, it is with the other supervisors. But I think for teaching, the supervision is very important. So we teach through the supervision in these 2 years.
Okay. Do you have any, let's say, selection process for those who would like to start their Gestalt training?
Yes.
Yeah.
We have. You mean at the beginning of the education?
Beginning, yes.
Yes. So we do these few workshops before,
Yeah.
to show them what it is, so that they can step back and not be frustrated when they come into the education. And then we have a selection workshops at the beginning. And at the beginning, we have also some criterion, so they know how we choose people, because sometimes we have to say some of them that they should wait and so on. So we have some formal criteria which are connected with our law of psychotherapy. So they have to have certain age and certain education, and so some of these formal preparatory criteria. And then there are a few things which we look at before the people start education. So what are our criteria is how is the ability to go into contact. Then what is the ability to look or to reflect about themselves and about the others, so how they can really see the other person, perceive the other person. Then we have ability to let the other be, so that they don't go too quickly into proving themselves right, or so that they just have the ability to let another person, to respect the boundaries of other person. Also, we look at their readiness to work on themselves, so the readiness to talk about themselves, to be open to the certain point at the beginning of the education. Then we look at the empathy, how much empathy do they have, and how much readiness they show to do experiments, to go into some risk. So this is generally, but it is like me and my co-therapist, or the trainer pair, are looking for this. So if
it's very interesting. So you mean that some could be refused?
Yes.
In the very beginning.
Yes, and it is proved to be very, very useful, because if you have somebody at the beginning who is quarreling for their rights, or who is really not respecting the other person, or who is not willing to talk about anything and so on, it makes it, then this person should go first to the therapy, to be more relaxed, and to have some experience in being in therapy before going into education for being a therapist. Some people can enter like this, but there are some who, if they don't have these abilities, they have to do first therapy by themselves.
Okay.
And then see if they are still willing to go into therapy education or not.
Okay. How did you develop this evaluational or selectional workshop?
So what we do is we do not just one, we do two of them.
Okay.
Yes, so that it is that we have more possibility to see the people, and they have more possibility to see how they are functioning in these circumstances. And it is because if you have two, I think it's much better than one. It is in the terms of organizing a group. If you have very good group, then this group goes on. If you have a group where you have to say some people, please go to your therapy or whatever before, then you have another possibility to include more people to get at the end a very good and compact group for starting education. I think we do a lot with this selection to have then a stable group which will stay through all 4 years.
Yeah. So it means that preparation process takes a while.
Yes, it takes almost half a year. So it is not, perhaps not, it depends when we start. So we are starting now in February with the group, but with this preparatory, with these few selection workshops actually, or these are those workshops which are not obligation. So everybody can join. It's not obligatory that they go on. It depends on them. It depends on us. But we need for this several months. So with this process, the starting point of education is about 3 to 5 months after the first selection workshop.
Oh, okay. Well, it's very interesting. And what do you think about possibility for those who are still in the educational process to begin their own practice? Should they finish the program first and then start to work with clients, or can they combine?
In our program, they all start working with the clients in the 3rd year, because to be able to go to supervision, you have to work with the clients. And they can work with the clients in our in the space of the institute. We have a small rooms where they can work with the clients. Or they work in the clients in their own practice. It depends, because if they are psychologists, they can have their own practice before coming into our education, and they can work as a psychologist. If they are not psychologists or medical doctors, they cannot open, but they can open whatever, some kind of organization for the quality of life, or they can work, sometimes they work with the NGOs and they work with the clients there. We have a contracts with these different organizations who would like to have not finished therapists because they are cheaper, and they have them to work then with the special groups of clients, like children or adolescents or old people or whatever. It depends on the organization. It's good for them because it's cheaper, and it's good for our students because they get clients and they have to have a supervision. Sometimes these organizations even pay for the supervision for the people who are working with their clients. And when the student works with somebody, this client knows that this is cheaper, but this is not a finished therapist. So they know they get cheaper therapy, but it is for everybody good. We try that it is okay for everybody. It's good for the students, good for the client, and the students can pay for supervision by working with these clients. So we do it in this way. But I think this is essentially important that the students work with the real clients during in our program, 2 years of the 2 years of the program, they are already working with the real clients.
Okay. In your opinion, what are the strong and what are the most problematic parts of education and Gestalt therapy?
I think the strong part is that the therapists work with themselves. So there is a lot of focus on individual therapy, on the experiential work. So since in the therapy, what we do in the therapy is working with our perception, with our feelings, with our intuition, even our knowledge, what to do in the contact. So there's a lot of abilities which you cannot read. You have to learn it by doing, and you have to learn it by being conscious. What are you doing? So it is, I think it takes a lot of time. So the whole education takes much more time than, let's say, cognitive behavior, where there is all structured, you have to learn it and then you know it. Here you have to, it is not just cognitive learning, there's much more complex. But I think it gives the students much better feeling when they start working with the real people. They have this feeling how to do it, and at the end they have a feeling, yes, I can do it. It is not just the knowledge, it is, cognitive knowledge, it is all together. This thing has also this other part, which is a weak part of the Gestalt education, and this is this lack of structure. The students are also frustrated because this is not so clear. They would like to have algorithm how to do it, first this, then this, then this, and this is in Gestalt not possible. So it is all a bit holistic, but through being very holistic, you don't have the direct lines what to do, and for sure not linearly. So what to do first, what second, but you have to have everything in mind and then apply this, what is the best in the situation. So it is sometimes frustrating for the students because it's very complex. It's not so easy, but I think it needs time. So when they are aware that it needs time, and at some point it will integrate everything what they learn. It will integrate, and in one moment they can apply it in the therapy with the person in the best way possible for this moment.
Okay. So, thank you very much for your generously sharing with your experience, and I'll be happy to meet you in person when our hard times will be finished. So, thank you.
Yeah, I wish you a nice conference. I hope there will be some discussion, and perhaps there will be some other opinions, and I don't know how this education is different from I know St. Petersburg or Riga or whatever. Are you similar, or how does it work? Do you know?
So one of the points is to discover the similarities and differences.
That's nice. Very good. So have a good time on the conference.
Thank you very much.